is Dr. Bill Cherniak, and I'm one of the co-founders and the executive director of Bridge to Health. Bridge to Health provides medical and dental services to partners in really rural, low-resource parts of the world. And we do that through clinical service provision, and then through education and training of local providers, and then research and infrastructure. And what we're doing here in the clinic is we're using ultrasound in a really innovative way to actually diagnose pneumonia in children and adults, and also to look for breast cancer in women. Problem here is that in these isolated rural villages, typically have mid-level providers.
And you can imagine that in settings where they have very limited access to diagnostic technology, it would be very hard for them to get radiology access. And so if these medical providers working in these settings can have these technologies readily available at the bedside, it can really help them make decisions.
So what we're using is this really cool new device that plugs into an iPhone and fits in your pocket, and you can bring it into the field, pop it on the patient's chest, and you don't need a radiologist, you don't need complex x-ray equipment, and you can be done in a day and know exactly what's going on with your patient.
The key things with pneumonia is it's hard for us to tell when it's bacterial or not, so we end up giving antibiotics to a lot of kids who don't need it, and that becomes a big problem.
Actually, we just had a baby who came in with a cough and a fever, and one of our emergency pediatricians who has training in ultrasound was asking, well, I don't see anything on the ultrasound scan, the baby looks pretty good, but the typical pattern would be to prescribe amoxicillin and an antibiotic. But we just had a conversation and said, well, the really cool thing is now the project's already working because we don't need to give antibiotics because we know there's no pneumonia and the baby looks well.